in thinking through what has worked in moving the needle on adolescent health on some of the areas I've just been lightly touching on, it's important to think about a number of different effective strategies that communities and states are attempting. It really takes a village to have this kind of impact, a synergy that occurs when you bring together comprehensive approaches, when the approaches are well funded and sustained across time, when you have multi-sectors of the society being involved. That is, even though we're talking about adolescent health, clearly there is a tremendous need for focusing on the education of young people, the youth development of these young people, as well as issues such as labor, housing, and juvenile justice. In many communities across the country and in a number of states, there are coalitions actively working on areas such as youth violence or areas like teenage pregnancy or mental health areas. It also requires the critical ingredients of a multi-level approach. That is, we bring together national, state, and local policy, and that these policies are implemented simultaneously, value added from the occurrence of having policies that bring together different funding streams and different reinforcers for what's going on at the national, state, and local level. It's really almost like an orchestra when it works well. And there's also a strong recognition that young people themselves often have to play a critical role in this arena. Finally, policies and programs are tailored, for example, to developmental age of the young person. If we cover the ages of 10 through 24, the developmental age is a very important ingredient to consider. We need to be thinking about community norms, geographic variation, as well as economic status. So as communities are implementing evidence-based practices as the knowledge base of what curriculum, what strategies work most effectively, it's clearly important to build upon that evidence, incorporate it in our strategies, and also bring the specific arenas of community values, community norms, as well as special area geographic variability that can be added on top of using evidence-based practices. Next. So let me give you a couple of very concrete examples of what I've just been outlining very briefly. So for example, in the area of smoking, we have seen the importance of legislative and regulatory initiatives. The area of public smoking bans, the substantial taxes on cigarettes, where cigarettes are available in a community, the kinds of restrictions on tobacco-related advertising to youth and in youth-oriented media, and also the tremendous value and synergy of bringing together public education and smoking cessation campaigns. So, for example, young people who grow up in families where their parents are not smoking are far less likely to begin smoking themselves. So having multi-generational efforts in some of these areas becomes extremely important as a conduit for success. Next. In another example, the reduction of alcohol-related motor vehicle crashes and their associated morbidity and mortality, we have seen the tremendous contribution of the graduated driver's licensing program across many, many of our states. This program really recognizing what's been called the tipping point of having critical numbers of hours which young people are required to have before they're able to drive on their own, and that they have the developmentally appropriate opportunity for developing skills so that they develop the self-confidence, the knowledge of how to be an effective driver. This married with issues such as a zero-tolerance alcohol law, as well as grassroots consumer movements. So, for example, we've had active engagement of parents, of students. In many schools, there are prom nights where adolescents come to the school gym and spend the whole evening there, including a breakfast in the morning, and are not out driving or having exposure to alcohol in their environments. And having the kinds of public awareness campaigns, the messaging of friends don't let friends drive drunk, has become a much more important part of our social norms, especially areas such as having a designated driver. And finally, there's been a very important contribution in developing both private and public partnerships. So we see a number of insurance companies that have played a very important role in giving special incentives for safe driving among young people, even though those are the years sometimes that premiums are raised.